Oh, we're live. So this is first in a series of interviews, and I've got my good friend and colleague Malik Khan today. So he's out of achievehealth.me in the UK, and great to have you here, Malik. Thank you for
Thanks, Bob.
talk.
Great
So
stuff. Thank you.
yeah, so yeah, I'm just gonna ask you some questions like what's it like? How so you practice Chinese medicine in the UK. What's the scene like out there? What is it like being an acupuncturist in the UK where you are?
At the moment, it's pretty bleak because of the lockdown. Obviously, you can't help people because obviously you're
Mm,
social distancing and all the other rules and regulations. It's a bit sad because Chinese medicine can really help, and it has helped those people in China with that the city where it first happened. I think 85% of the people had herbs, Chinese herbs, not just any old herbs, but Chinese herbs. So they, as well as the Western medicine, they applied the Chinese medicine as well. So both of those two marriages really helped, and that's probably why they had a very low um, uh, rates of infections there or death. So it's a bit sad here that we don't have the same access or facilities. That's probably one of the reasons why we got so high numbers. So yeah, so at the moment it's pretty big, but however, Chinese medicine is very popular in the UK. I'd say it's over the many years it's gradually grown, and I think it's one of those missing part of the national health system where I wish it could be part integrated fully rather than an alternative, basically. So yeah, it's an exciting time, and I've seen some fantastic results. I mean, I would have never gotten to this medicine um, if I didn't see, if I couldn't see. You know, the old saying, "Seeing's believing." You can't really see everything,
yeah.
but I've seen a lot of stuff which doesn't make sense. If it didn't work. So so it's working. So that's you know, uh, not there for fame or fortune. I wouldn't mind it though.
Yeah.
But yeah, I'm not there for that. So it's key to help as many people as possible. My target is to help 100,000 people, okay, before I pass this world. Okay,
That's
that's my main sort of like motivator. So,
and I was actually looking through your bio. So you're part of many associations. You're part of the British Acupuncture Council, Acupuncture Fertility Network, British Pain Society. What got you into acupuncture? Because I remember on your website it says you used to do systems analysis. So I guess Chinese medicine is very analytical. What was there? What brought you into Chinese medicine?
yeah, good question. Um, it's a bit of a complicated one, really. I've always had a liking for Chinese culture, being frank with you. I think it started off when I was probably 8, 9 years old. In those days, there used to be a program or a TV sort of kind of film, a regular one called Water Margins. You've probably never heard of it.
No, I haven't.
Um, Before your time. But it was fantastic. I think it had David Carradine or Carradine. Okay,
Okay, yep.
an actor. And it used to be on BBC Two, pretty late in the evening. I think 9 or 10 o'clock. And I grew up watching that. And even though it wasn't in English, it was in Chinese. There would be subtitles, so I used to follow that. But there was something within the Chinese culture which really attracted me to it. And then as I was growing up, I obviously came across the famous, Bruce Lee. Okay, so again, there. So, I've always been open-minded. I've never closed my mind to a particular culture or way of life or whatever. So, and acupuncture really, how came across that was that really I needed to treat myself. I had some issues. I can list a dozen plus issues I had, personal ones, and specialists over here, consultants saying, you need this, you need that, etc., etc. And my feeling was it didn't seem right, even though I had recommendations from friends that were, specialists in the fields, i.e. GPs in the field, are saying that you must have it, you must have it. It just wasn't right, and it didn't feel correct. And anyway, the risks were too great, being honest with you. I didn't want a knee surgery, I didn't want a back surgery, I didn't want etc. 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 And I went for acupuncture a few times, and it was I wouldn't, and that helped me significant to a great extent. But I think the key moment was when we relocated from the south to the north of the country, and there was a beautiful Chinese lady in our town, our hometown, and I went for treatment there, and the rest is history, basically. You know, she sort of she was welcoming, and she was encouraging me. This is going back over 10 plus years. Encouraged me to do Chinese medicine. I mean, I didn't even know this lady. But she spoke very little English. Honestly, very little. All she needed to know where the pain was. She practiced traditional Chinese medicine, so acupuncture, cupping, massage, and some herbs. I must admit, I didn't like the herbs because they were raw herbs, and it tasted awful.
Yeah.
So, but she was a wonderful lady, and and I think, you know, yeah, and she was really the kind of the motivating factor, really. That's one of the key things. But there's again, like I said, it's complicated as well, because that's one aspect of why I wanted, and I got into it. Now, another aspect was my daughter was ill, or is still ill, and I was just searching, knocking on doors, trying to find out, because obviously after 10 years, we still don't know what the diagnosis is for her. Well, we do know, but we don't have a clue as to how to fix it. So that was my main sort of thing, trying to find some answer to how to make her better. And that's the other, or should I say, the main reason I got into Chinese medicine, was to learn and to find out if I can help her. So as well as my 100,000, she's equivalent to 1 million to me. So if I can help, so that would be my dream. So yeah, it's a bit complicated why and how, but that's what keeps me ticking, basically.
Yeah, wow. And what is the education requirements for in the UK? Is it 4-year degree? Is it what does the education entail? How is the training?
Yeah, great. It's a 3-year full time. I mean, I had some fantastic professors from China teaching the program at University of Lincoln, and there's other places as well. And these are chaps that have been at, I think one of them was at Beijing University or hospital. So they got, you know, fairly good sort of background, hospital background from China. It was a full-time degree course with, I don't know how many hundreds of hours of clinical time as well. So it's quite rigorous, very demanding, a lot of patient interaction, and it's all based around TCM, old traditional Chinese medicine system of teaching. But yeah, but for me, it was just 3 years of that full time, and also 3 years previous to that as well, because I did another program before that. That was got into sort of like did a diploma in Chinese medicine, acupuncture, and did Tuina as well, and a master's in Tuina.
Oh, master's in Tuina.
Yeah. So a master practitioner. Okay. So yeah. So and I think because so you could say it's a 6-year. For me, it's been a 6-year program, learning that as well. And I did sort of do homeopathy as well, but I didn't find that it could really answer many of the questions, or, you know, help with many of the things which, you know, acupuncture can.
Mm-hmm. And you mentioned earlier you've had some really great success with headaches, and
Yeah.
And you have a special interest in fertility. For those of us that don't know, how does acupuncture work for fertility?
Okay. Acupuncture it's amazing for all conditions. Its main way how it works is through moving blood. Okay. So why blood? You know, within the blood contains all your nutrients, all your hormones, all your messengers. So all that you need, okay, right? The body needs, or the organs need, is through the blood. So if you can sort of like get the blood flowing to the right places, you can help virtually any condition. So whether it's fertility or neuropathy, whether it's headaches, back problem, etc. It's not anything magic. It's basically a physical medicine, and it works. So yeah, and we know from studies as well with fertility that it has a very high response rate, success rate. So yeah, it's amazing. So when those studies do take place, they do show some fantastic results. But we can't always rely on studies. There are many. I mean, it does amazing stuff for other areas as well, and there are not many studies there, but I've seen them with my own eyes. And I had one person the other day. I told him I had to do some stuff on the acupressure, and within a minute he said, "Was that magic?" So I need these testimonials from these people rather than me saying it. But yeah, so it's amazing.
Yeah, and you get really great results with headaches as well.
Yeah, we've. I mean, there's a government. It's a NICE is called National. This is an organisation called NICE. It recommends GPs to refer their patients for headaches in the UK. So National Institute of Clinical Excellence. So they recommend. So on the NHS website, they say headaches. You can get referred. So it used to be for other conditions, but they've changed it. They said, oh, now it's headaches. But yeah, so we get, I think most conditions, to be honest with you, you get fantastic results. So yeah, I've been treating quite a lot of headaches patients, and amazing sort of results.
And what about neuropathy? Is that something you treat as well?
I've treated it and I've got good results, and it's amazing. Getting results within, I would expect it after about maybe 6 treatments to get a good gauge, but after the first treatment, amazing, 50% result. 50% of the feeling was coming back to the
amazing.
I was astounded,
And so, say if a patient were to come see you, what would that process be like? So, say if I was a patient, I came to your clinic, what would a typical initial visit entail?
Okay, right, great, good question. So we do so the first visit would be like consultation, but we call it initial exam. Okay, it's initial examination. So that'll be up to 60 minutes. And generally we'll go through your medical history. We'll go through finding sort of like, what your main concerns. And generally most people come with, when they come to us, they come with, maybe a dozen problems. But we'll take the top 3. And out of the top 3, we'll home in on 1 or 2 that like treated straight away. Okay. That's what we'll concentrate on the first initial sessions. We'll carry out a pulse diagnosis, and this is not your a typical pulse diagnosis, which a nurse will come and put your fingers on your hands and run away. This is in-depth, could last 20 minutes. Okay, and that will give us a good basis as to what's going wrong with your organs, and from there we can base and also get your life effect as well. How's it affecting your life as well? So we want to get a complete picture after that first session, and then from there we'll know what program we'll use to gauge your response. Because if it doesn't work after the first couple of treatments, it's not going to work for you. So after the first 3 treatments, if you're responding well, great. Okay, it will work for you. So and we'll continue. If it doesn't, then we'll stop straight away.
And what percentage of people that come to your clinic get a response within those first 3 treatments?
Okay, I have to think now. Because the style of acupuncture that I'm using now compared to what I used to use before is different. I mean, they both work. They both work. They're fantastic. Okay. The response I get now within I'd say the first, second session would be it's amazing. So I'd say I would say nearly everyone I've treated has had a response, whether it's 20%, 50%, 60% after the first initial treatment. But the good gauge is after the 3 sessions, you want to see how, it could be 80%.
Wow, that's amazing. Like it never gets old how it impresses me. Like and it's amazing knowing that you're over in UK and there's practitioners all over the world and we have this wonderful tool at our disposal.
Yeah.
And
Yeah.
yeah, that's just nice to know that it can work anywhere.
Yeah, it's amazing. It's amazing. And if you don't have your fingers, well, if you don't have the needles, you can use your fingers.
Yeah, we
So
talked about that before we came live. Before we wrap up, what would you say is a great acupressure tip for people out there that you usually recommend for your patients since you're not treating right now? What can you recommend for the people out there?
okay, that's a bit of a difficult question because it depends on where the pain is. Okay, so where your pain is, it'll depend on where your pressure point or trigger point or your treatment point will be. So depending on where it is, and we can sort of like we'll have to sort of then do it that way basically. So it's a bit difficult, but but you can, for example, let's talk about one case I had recently. Chap had knee problem. Okay, inner side. Obviously, the outer side and inner side is going to be different depending on the lateral, medial, anterior, etc. So a good point, if you have a knee on the inside, do the opposite arm. Okay, inside or outside, depending on where you find some pressure points. So you can find the elbow joint, so joint for joint, basically. It's a good sort of like marriage. So if you have pain on your elbow, sorry, on your knee, okay, and then press on a certain part of your elbow. But so the elbow joint's a good one, but you have to be really talked through it, really. So yeah, but that's a good quick tip, I guess. But these are temporary. The best one is obviously you really need to come in for an acupuncture treatment, and along with that with herbs as well. So you need those two, those two as well.
And you do herbs as well.
Yeah, I'm starting. I started the herbs at the moment because of the shops are all closed and the suppliers aren't supplying, so I don't have any herbs to give out yet. So, but yeah, so we mainly sort of like acupuncture at the moment, and
Okay, great. And we're just gonna finish up. So what is the best way to find you? Well, what is your website? What is your social media handles? Where can we find you?
okay, great. So I'm on website is achievehealth.me, all one word, achievehealth.me. I'm on YouTube as well. I don't know the link for that, I'm afraid. I'm on Facebook as well. But if you go to the website achievehealth.me, you can click the link there, and that will take you to the Facebook page, and the contact details are all there as well as the website. So you can find us anytime via the website. And yeah, so we're on. Yeah, so our telephone number, if you need to contact us, is 0786 1555 910.
Brilliant. Awesome. So I think we'll wrap it up here, but this yeah, it's been great learning what it's like practicing in UK and just hearing about your experiences. It's encouraging. I think it's only going to grow. So yeah, thanks for listening, everyone. We'll see you in the next one.
Thanks, Bob. Thank you very much.
Thanks,
Thank you for
Malik.
having me. Thank you. Thank you.